Most people over 55 try to fix balance after 60 the hard way, spending hours on complex exercises that don't translate to real world stability, buying expensive gadgets that end up gathering dust. Today, I'll show a natural routine that actually works. It's simple, effective, and you can do it right in your living room. Wait, can goldfish get bored? This isn't some random internet fad. This routine comes directly from physiotherapy research and years of experience in real world clinics. We've taken the core principles of balance rehabilitation and simplified them for safe and effective home use. We're talking about proven techniques used by professionals to help people regain their stability and confidence. This approach focuses on retraining your body's natural balance mechanisms rather than just building strength. We're targeting the specific muscles and neural pathways that control your equilibrium. We'll cover 3 quick balance moves, 2 essential food fixes, and 1 critical mistake to avoid. Stay tuned for move number 3. It often provides the fastest relief. Each element builds upon the others to create a comprehensive and sustainable improvement in your balance. We'll break down each move with clear demonstrations, timed intervals, and crucial safety cues. We'll also explore how simple dietary adjustments can significantly impact your balance and highlight a common pitfall that many seniors unknowingly fall into. Move number 1, the gentle heel raise. Let's begin with a foundational exercise, the gentle heel raise. This move targets your calf muscles, which are essential for maintaining balance, especially when standing or walking. It's a low-impact exercise that's suitable for all fitness levels. How to perform the gentle heel raise. Stand near a stable surface, such as a countertop or chair, for support. Place your feet shoulder-width apart with your weight evenly distributed. The movement, slowly rise up onto your toes, lifting your heels off the ground. Focus on engaging your calf muscles as you lift. Pause briefly at the top of the movement, maintaining a controlled balance. Slowly lower your heels back to the ground, controlling the descent. Perform 10 to 12 repetitions of this exercise. We will be doing this for 30 seconds with a 15-second rest. Remember to breathe. If you feel any pain or discomfort, stop the exercise immediately. You can modify the exercise by holding onto a chair for added support or reducing the range of motion. If standing is difficult, you can perform this exercise while seated. Simply sit in a chair with your feet flat on the floor and rise up onto the balls of your feet, lifting your heels off the ground. Strengthening your calf muscles improves your ankle stability, which is crucial for preventing falls. It also enhances your proprioception, which is your body's ability to sense its position in space. Avoid rushing through the movement or using momentum to lift your heels. Focus on controlled movements and engaging your calf muscles. As you become more comfortable with this exercise, you can gradually increase the number of repetitions or try performing it without holding onto a chair for support. Now, let's move on to the second exercise in our routine. Move number 2, the single leg stance. This exercise directly challenges your balance by reducing your base of support. It forces your body to engage your core muscles and activate your balance reflexes. How to perform the single leg stance. Stand near a stable surface, such as a countertop or chair, for support. Place your feet shoulder-width apart. Gently lift one foot off the ground, balancing on the other leg. Keep your lifted foot close to your standing leg. Hold this position for as long as you can maintain good balance, up to 30 seconds. Repeat the exercise on the other leg. Perform 2 to 3 repetitions on each leg. We will be doing this for 20 seconds on each leg with a 10-second rest between each leg. If you feel unsteady, immediately place your foot back on the ground. You can also modify the exercise by lightly touching a chair for support or reducing the duration of the hold. To modify this exercise, you can lightly touch the ground with the toes of your raised foot for added support. Another option is to practice shifting your weight from one leg to the other while keeping both feet on the ground. The single leg stance improves your balance by strengthening the muscles in your ankles, legs, and core. It also enhances your proprioception and challenges your balance reflexes. Avoid locking your knee on your standing leg, as this can reduce your stability. Keep a slight bend in your knee to allow for better shock absorption and balance. As you improve, try holding the position for longer periods or closing your eyes to further challenge your balance. Ready for our next move? Move number 3, the Tandem Stance, heel to toe. This exercise builds upon the single leg stance by further narrowing your base of support. It simulates the balance challenges you encounter during walking and helps improve your overall stability. How to perform the Tandem Stance. Stand near a stable surface for support. Place one foot directly in front of the other so that the heel of your front foot is touching the toes of your back foot. Imagine you are standing on a tightrope. Maintain your balance in this position for as long as you can. Aim to hold the position for at least 20 to 30 seconds. Repeat the exercise with the opposite foot in front. Perform 2 to 3 repetitions with each foot in front. We will be doing this for 20 seconds on each side with a 10-second rest in between. If you feel unsteady, widen your stance slightly or place your foot back on the ground. You can also modify the exercise by lightly touching a chair for support. While a seated version doesn't directly replicate the balance challenge, you can practice weight shifting from one side to the other while seated, mimicking the subtle adjustments your body makes in the tandem stance. The tandem stance challenges your balance by reducing your base of support and forcing your body to make constant adjustments to maintain equilibrium. This improves your proprioception and strengthens the muscles responsible for balance. Avoid looking down at your feet, as this can disrupt your balance. Keep your head up and focus on a point in the distance. As you improve, try holding the position for longer periods or closing your eyes. You can also try performing the exercise on a slightly uneven surface, such as a folded towel or pillow. Ensure this is stable and safe. Now that we've covered the 3 balance moves, let's talk about food. Yes, food. Your nutrition plays a bigger role in balance than you might think. Good balance isn't just about exercise, it's about nourishing your body properly. Ready for the first food fix? Food fix number 1, prioritize protein. Protein is essential for maintaining muscle mass, which is crucial for balance and stability. As we age, we tend to lose muscle mass, making us more susceptible to falls. Protein helps counteract this loss. Why protein matters for balance? Protein provides the building blocks for muscle repair and growth, which is essential for maintaining strength and power in your legs and core. Stronger muscles improve your ability to react quickly and prevent falls. Protein also plays a role in bone health, which is important for preventing fractures in the event of a fall. How to increase your protein intake. Include protein in every meal. Aim for 20 to 30 grams of protein per meal. Good sources include lean meats, poultry, fish, eggs, dairy products, beans, lentils, and tofu. Snack on protein-rich foods. Choose snacks like Greek yogurt, nuts, seeds, or hard-boiled eggs. Consider protein supplements. If you're having trouble meeting your protein needs through food alone, consider adding a protein supplement to your diet. Consult with your doctor or a registered dietitian to determine the appropriate dosage. Examples of protein-rich meals. Breakfast, Greek yogurt with berries and nuts, scrambled eggs with vegetables, or a protein smoothie. Lunch, salad with grilled chicken or fish, lentil soup with whole grain bread, or a turkey sandwich on whole wheat bread. Dinner, baked salmon with roasted vegetables, chicken stir-fry with brown rice, or a vegetarian chili with cornbread. Next fix is something you probably already have at home. Food fix number 2, embrace hydration. Dehydration can lead to dizziness, lightheadedness, and impaired balance. Even mild dehydration can affect your cognitive function and reaction time, increasing your risk of falls. Why hydration matters for balance. Blood pressure regulation. Dehydration can lower your blood pressure, leading to dizziness and lightheadedness. Cognitive function. Dehydration can impair your cognitive function, making it harder to react quickly and maintain balance. Muscle function. Dehydration can lead to muscle cramps and weakness, which can affect your stability. How to stay hydrated. Drink water throughout the day. Aim for at least 8 glasses of water per day. Increase your fluid intake during hot weather or when you're physically active. Eat hydrating foods. Fruits and vegetables like watermelon, cucumbers, and spinach have a high water content. Avoid sugary drinks. Sugary drinks can dehydrate you and provide empty calories. Listen to your body. Drink water when you feel thirsty. Tips for staying hydrated. Carry a water bottle with you. Keep a water bottle with you throughout the day and refill it regularly. Set reminders to drink water. Use a timer or app to remind you to drink water every hour. Make water more appealing. Add slices of lemon, lime, or cucumber to your water for flavor. Maintaining proper hydration is also key for healthy blood circulation, which carries vital nutrients to your balance regulating systems. Now let's move on to the one mistake you must avoid. The mistake to avoid: ignoring inner ear issues. The inner ear plays a crucial role in balance. Problems with the inner ear, such as vertigo or Meniere's disease, can significantly affect your balance and increase your risk of falls. It's the control tower for your whole equilibrium system. Why inner ear health matters for balance. Vestibular system. The inner ear contains the vestibular system, which is responsible for sensing head movements and maintaining balance. Sensory input. The vestibular system provides important sensory input to the brain, which helps you maintain your orientation in space. Balance reflexes. The vestibular system also triggers balance reflexes that help you maintain your equilibrium. What to do if you suspect an inner ear problem? Consult with your doctor. If you experience dizziness, vertigo, or other balance problems, see your doctor for a diagnosis. See a vestibular therapist. A vestibular therapist can assess your inner ear function and develop a treatment plan to improve your balance. Consider medication. In some cases, medication may be necessary to manage inner ear problems. Treatment options for inner ear issues. Vestibular rehabilitation. Vestibular rehabilitation is a type of therapy that helps retrain your brain to compensate for inner ear problems. It involves a series of exercises designed to improve your balance, coordination, and vision. Medication. Certain medications can help reduce dizziness, nausea, and other symptoms associated with inner ear problems. Surgery. In rare cases, surgery may be necessary to correct inner ear problems. Question 1. What if I'm already taking medication for a different condition? Answer. It's crucial to discuss all medications with your doctor to ensure they aren't contributing to balance issues. Some medications can have side effects that affect balance. Question 2. How long will it take to see results from this routine? Answer. Results vary depending on individual factors, but most people start to notice improvements in their balance within a few weeks of consistent practice. Question 3. What if I have other health conditions? Answer. Consult with your doctor before starting any new exercise program, especially if you have any underlying health conditions. Better balance means a better life. Subscribe and start your journey today. Don't forget to consult with your healthcare provider before making any significant changes to your diet or exercise routine. Stay safe, stay balanced, and I'll see you in the next video.